Those Friday night lights are just weeks away, and football players across the basin are practicing and getting ready for the start of the season. While it's an exciting time, it's also critical for players, coaches, and families to think about safety, especially with head injuries. Dr. Terry Beck from West Tex Urgent Care thinks that equipment companies have done a better job creating protective gear, but helmet-to-helmet contact can be dangerous.
That's where typically the most severe injuries happen. That and people getting blindsided, that kind of thing. They've really tried to cut down on that type of play. Just it's not good for the sport because of the potential for head injuries.
Dr. Beck says that a person can still have a concussion even if they're not knocked out. That's why he tells us that it's critical to look for symptoms.
In other words, somebody has a head injury and they come in and they have, even 10 days, 7 or 10 days later, they're having headaches, they're having some amnesia, they're having difficulty concentrating, they're irritable, bright lights may bother them. There's a whole spectrum of symptoms that may be associated with concussion. And those symptoms can persist for a month or two or even more sometimes. Usually most symptoms will go away sooner than that.
Dr. Beck tells us that more severe symptoms can include acting differently, being more tired than usual, weakness in the arm or leg, and throwing up 2 or more times. Now, as a former football player, the doctor knows that sometimes team members feel like they need to play through their pain, but it's not worth your health.
And, 20, 30 years ago, that was very common, not only from the players, but from the coaches. But now, we've gotten smarter. We've recognized that even a mild head injury, if there's a repeat head injury in a short period of time, can cause significant brain injury. So if someone gets gets dazed from a blow to the head, or they're making a tackle, or they fall and hit their head, they usually need to be removed from the game for at least a period of time. Have some type of trainer or medical professional do a quick neurological check on them. And if there's any symptoms at all, they're typically going to be held out of the game to reduce the chances or avoid getting that what we call second impact syndrome. Whereas even a relatively minor head injury, if it's followed in a short period of time by a second head injury, it can result in a very severe head injury.
Dr. Beck says athletes should tackle with their shoulder rather than their head to avoid brain injuries. The doctor encourages players and their families, as well as coaching staff, to educate themselves about head injuries. If you do get hit in the head, you should go to a doctor to make sure that it's nothing severe. And if you would like to speak with Dr. Beck yourself or make an appointment, check out westtexurgentcare.com. They have 3 locations in the Basin, 1 in Odessa, as well as 2 in Midland.